The meeting will begin in 10 seconds.
See you. Got to see her before it comes on. There we go.
Good afternoon. I'm Sheila Bunch. I'm the Vice Chair of the Board. I'd like to call our September the 10th meeting to order. And at this time, I'd like for us to observe a moment of silent prayer or silent meditation. Thank you. At this time, we do not have any public comments, and we need to move on to adopting or revising today's agenda. Are there any adjustments to today's agenda?
No, Madam Chairman, I move that we approve the agenda as printed.
Is there a second?
Second.
All those in favor say aye.
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 All right. You've received the minutes from our last meeting. Is there a motion to adopt our minutes?
So moved.
Second.
It's been moved and seconded that we would adopt our minutes from our last meeting. All those in favor say aye.
Aye.
Opposed? At this time, Ms. Elliott will be introducing the new staff who've joined the Department of Social Services.
Okay, so we're going to try something new this time. We're going to hope to start doing this on a regular basis. We want to introduce the staff who have joined us in the last month. So as I call your name, if you'll come forward and introduce yourself to the board and let them know kind of what you do. And the board will introduce themselves after we introduce all y'all so that you'll know who your board members are. John Binder is our first person. John, you want to come forward? Tell them what you do.
Good afternoon, John Binder. I just got hired as an income maintenance caseworker for adult Medicaid redetermination.
Okay, welcome aboard.
Thank you.
Welcome.
Where did you, are you come from another county?
No, this is
Just
my first experience
That's
here.
good,
Yes.
thank you.
And if I remember correctly, you're a veteran?
I am, yes.
Yes. Okay.
Thank you for your service.
Welcome.
Thank you.
Absolutely.
Thank you.
Okay, great. Thank you so much.
Thank you.
Okay, and so let's get Tamika Washington.
Good afternoon. I'm Tamika Washington, and I just got hired for the income maintenance caseworker position, and I'll be doing food and nutrition redeterm.
Okay. So welcome.
Welcome.
Welcome. So, did you want to ask a
I
question?
want to ask her the same question too. I'm always like to know when their internal promotions are outside immigrants.
No, I didn't come from any other county, so I'm
Good.
brand new.
Thank you. Welcome.
Okay. Is Shanice here? I didn't see if she came in.
Yes.
Yes, there you go. Okay. This is Shanice Robertson, and I'll let her introduce herself and tell what she does.
Well, I just started yesterday, so I got lost. I apologize.
That's
I'm
quite all
on the
right.
fourth floor. I just was hired as the post-op position at Vidant, the APS social worker, and I came from Integrated Family Services, Dr. Butch, and Martin County Department of Social Services.
Very
Welcome.
good.
Welcome aboard.
Welcome.
Okay, so you guys want to introduce yourselves then to them?
Yes, my name is Daron Dancy. I too am a military veteran.
I'm Sheila Bunch. I'm the director of the School of Social Work at East Carolina.
I'm Mary Perkins Williams, Pitt County Commissioner for District 2, and I retired from East Carolina University.
I'm Catherine Nelson. I'm the Senior Administrator at Vidant Medical Center for Community Health.
Welcome aboard to all of you.
Welcome.
Okay, great.
All right.
Thank you.
And thank you for coming. We hope your experience will be very productive here. At this time, we will move into our items for consent. What is the board's pleasure? Would you like to take one at a time or accept them
Madam
as a
Chairman.
group?
I'd
Yes.
like that for us to approve the items for consent and move forward.
Second.
All right. So, items for consent, Mideast Commission, annual contract renewal, budget amendment shift, budget amendment roll forward funds from prior fiscal year, budget amendment Casey Family Programs, parent partner. So, you are moving that we approve the consents as a group. Is there a
Yes.
second?
Second.
It's been moved and seconded that we approve the items for consent as a group. All those in favor say aye.
Aye.
Opposed? Motion carries. At this time, we will have our, move into items for report. And Ms. Elliott will talk to us about the MOU.
Okay, you all should have in front of you a copy of a document that kind of outlines very quickly for you our performance over the last quarter. We also have a slide presentation which will help us run through this also with the public. So as you remember, or as you need to know, we have 26 compliance areas that we have to meet. Of those 26, there are 13 that at this point are mandatory, and the remaining 13 will not take effect until sometime in the future, probably during 2020, as they continue to work on fine-tuning the reporting. So that would be our first point to say. Now, we have tried to color code these for you so it makes it easy to pick up where we're in compliance, where we're very close to meeting compliance, and where we're currently out of compliance. We had agreed earlier that we would try to do this report on a quarterly basis, and we are giving you information about all 26, even if those reports are still not 100% accurate, and we're continuing to work on this. So we will walk through the compliance areas so that you can see kind of where we are. So on the next slide, you can see that child support has mandated performance measures. Their performance measures, even though we're looking at it on a monthly or quarterly total, their performance measures really are annual performance measures, and so we just need to know, are we on target moving forward? So if you look, you can see that we are at 90%, so very close on the paternity establishment, and that will certainly change as we get closer to the end of the year. We need to have 89.79% of our cases under order, and as you see, we are certainly meeting that requirement, as right now we have 90.19% of our cases under order. The 65.51% of current payments need to be collected. We're at 65.96%, so again, very, very close to that mark. 69% of applicable cases are included in the arrears collections, and at this point, again, because it is a moving target and it takes the whole year, right now we're at 31.37%. We've done the first quarter, so it looks like we're well on target to move forward. But again, it's so far at this point, we couldn't really code it. We are required this year to collect $15.7 million, because that's what we collected last year, so we have to collect at least that much. We are moving forward there. We're collecting at 97% of where we should be at this time in the year. So we certainly are moving forward there. What I will remind folks is that with child support, the collections go up significantly during the tax season, because we do, if you're behind in your child support a certain amount, we can get access to your tax money. So that generally bumps up. That's the big collection quarter during taxes. So we're doing well in child support. Our energy programs, these are mandated. We are to have 95% of our SIP applications completed in one business day, and at this point, we are not meeting that. That's a combination of issues. One has to do with the fact that the state will not allow us to pay the water, the garbage collection, any of those things that might be on your electric bill. All we can pay is the electric bill. So if you bring us an electric bill of $250, or a bill of $250, over $100 of that might be all those extraneous things. We could pay the $150, but we're not generally going to pay the $150 until we've had proof that that other's been paid, because you're still going to be cut off, because at this point you're at the cutoff notice. We are still trying to figure that piece out, because it's really hard to turn it around in 24 hours when you've got that kind of situation. With our non-emergency crisis applications, they have to be processed in 2 business days. We're at 91%. I think generally that's pretty good, and we will continue to work there to improve that. Again, we have 5 staff who do this, and some days we can have 100, 150 people sitting at the door. Other days we might have 40 or 50 people. So the volume can clearly determine how much we're able to do within a day. And this is where we get a lot of our complaints from people having to sit for a long period of time, because again, you've got to interview these folks. You've got to get the information. We want to help them as quickly as we can. We try to do group interviews, et cetera, but it still requires some one-on-one to talk about each individual situation. Yes, ma'am.
For the public's sake, what the CIP stands
Crisis
for?
Intervention Program. I thought about that after we got started on this. So yeah, crisis intervention. And this is an energy and emergency situation where you have a heating or cooling emergency, and it when the weather is not real at either extreme, we have to have some type of a medical emergency to allow us to assist you. But if the weather is really extreme, real hot or real cold, we can do that fairly easily. So you have to have a medical emergency, and that's got to get proven too as to what the medical issue is that needs to be addressed. So if you then move forward to work first, our part of this is mandated and part of this is future. The mandated portion is the timeliness of applications and process and recertifications, and as you can see, we are certainly meeting those requirements. The other area has to do with the work requirements that are out there for folks to meet. Nobody in the state, or if there is, I'm surprised that anybody in the state is actually meeting either one of these. The state is not meeting either one of these requirements. And you know, you can kind of get a sense as to why that might be. For example, we had in the 2-parent households, if you look at the other document, we had 2 people in the denominator, 2 people that were required to meet this requirement. 1 person met it. With the other area, the 50%, we had 12 people that met the requirement out of 58. So again, small numbers, which makes it difficult. And we have no daycare right now. So if you are a family member, a person who has to have child care in order to go look for work, makes it very difficult to hold you accountable. We still ask you to do that, but it makes it difficult to hold you accountable. So that's part of what's going on here. We will continue to work at this, and we are meeting the mandated portion that's required right now. So then if you move to our food and nutrition area, you can see that we are meeting with no problem all of our expectations there. We are meeting our application timeliness, we're meeting our recertification timeliness. And we are meeting our program integrity claims establishment for food stamps in a timely manner. Again, you know, staffing can have an impact here, and when we're short-staffed, it could cause us to fluctuate, but staff are doing a really good job with that. So if you get to child welfare, this is a future area, and you can see that we have some areas where we're doing well, some areas not so well, and some areas we're getting close. So if we talk and look at our investigations, we are in fact meeting that timeliness requirement there. When we get a report, we are initiating in a timely fashion. We are having a problem with children receiving subsequent findings of maltreatment, so you get a second report and there is another finding of maltreatment that can cause us to not do well here. We have gone up and down in this area, so it has not consistently been a high number, but it is right now. The foster care visits, we have to interact with our children, 95% of our children every month. We have to lay eyes on them, and we are doing that in a fairly consistent manner. You see we missed it by 1% this past quarter, so we're doing that pretty well. When you get into the next section, the foster children discharged to permanency within 12 months, we are at 13%. Now, I have to tell you also with child welfare, and I should have said this initially, for some of these, we are looking 12 months back because you can't tell you whether anybody's come back into care or done anything until you've looked at the full 12 months. And that's stated on your your handout. For example, for most of the child welfare things, we're looking at August of 2017 through July of 2018, or April of 2018 through March of 2019. So you can see that these are old figures. And part of that is back when we had a lot of turnover going on and were understaffed. I think you're going to see better numbers, but what I can say to you is we still have a fair number of foster children who've been in care for a long time, who are going to keep that number low for a while longer till we can work through some of those. Our permanency roundtables are helping in this area because we have been able to send some of those children into a permanent situation fairly recently. Of the children, I think of the 30-some we've roundtabled, 11 or 12 have moved to permanence, and so those are our long-term foster children. Our foster children are not re-entering foster care generally, so we are in compliance there. And our placement moves are still a problem for us. We are not supposed to have any more than 4.1 placement moves per 1,000 days, and as you can see, we are double that, basically. Again, that has to do with a variety of things, one of which has to do with the trauma that some of these children have experienced, some of the mental health issues, and we are moving really hard into doing a lot more trauma-focused work, as you've heard over the last few months, to try and help our foster parents with some of this. So we're continuing to work on that. So that's where we are with child welfare. Our adult services, we don't have current data right now on evaluations for abuse, neglect, or exploitation, so we'll get you those in the next quarter. Our special assistants, you can see we're meeting that criteria for both of those processes, and we're also meeting our child care criteria at 100%. So about 50% of our requirements we're meeting, whether they're current or future kinds of requirements, and about 50% we could do some more work on.
Okay,
So,
thank you. Are there
Questions?
questions for Ms. Elliott
I like
about
this
where we
report.
are with our benchmarking?
Thanks for the color coding.
we can count an expert person on the staff who is doing this for me.
We thank you for that,
Yes,
to the expert.
yes, yes.
Okay, now we need to move into items for decision. And we have the director's work plan, and you should have a copy of what Ms. Elliott plans to do for this year. in terms of how she will be evaluated in the spring. So, you have a copy. You want to take a minute and look at it to see if there needs to be any amendments to the plan, or we can
I thought I saw it. in
table
my
it
packet.
until next month, when you've had a chance to really look at it.
Yeah, okay.
What's your pleasure?
I suggest tabling until next month.
When all
Okay,
of you are here and you've had more time, right?
Yeah.
all right. Do we need a motion for that, or we can
What
just
does it
table
look
it?
like? It wasn't in my
She
bag.
sent it separately.
It was in the email.
It was in an
attachment.
email.
Right.
Oh,
Right.
if it's in the email, I haven't been.
So it's not in
on
here.
my computer.
I
Okay.
don't, Susan, is it in the handout packet? No, it was just in the email packet.
So you, could you get me a copy, please? Thank you.
All right, so it seems that we are concurring that we will table this item until next month, and everyone would have read it.
Can we delay it rather than, table just doesn't sound good to me.
Okay, Ms. Mary does not like the word table, so we will delay the decision on
Yes.
this particular item until our October meeting.
Yes.
Can I say one thing?
Yes.
I have to take it.
There are two parts to the plan. One is specific performance objectives, which is, for example, making sure that we use the strategic plan correctly, use that for our budgeting decisions and all of our staff decisions. So that's one example. The other thing we have in here is factors. And factors are things like dependability, et cetera, and that's how the county has their plans set up. So I wanted to make sure we are required to do a certain number of factors. We have to do dependability, we have to do quality of work, we have to do customer service. As a supervisor, I have to do supervisory practices, and I can choose 2 other factors. I can choose many more than that, but I can choose 2 other factors. So I wanted you to be aware of what the other factors were in case you have some thoughts about that. Teamwork is one, job knowledge is one, quantity of work is one, leadership and fellowship is an example. The rest of them are already in the plan, so you can see those that were chosen. But I wanted you to be aware of those in case you want to, we have to write objectives and stuff with each one of those, but in
What was
case
the
you.
one after job knowledge?
Job knowledge, quantity of work.
Quantity, okay. Got it.
So I wanted you to have that as you're thinking through.
What was after leadership?
Leadership fellowship was one
Fellowship. Okay,
factor,
okay,
depending on where you were in the structure.
okay.
All right, so everyone needs to complete their homework for our next meeting. At this time, we will have our director's report from Ms. Elliott.
Okay. Medicaid transformation is becoming very important to all of us, and so that's what we're going to talk about a lot today in the director's report. The state is beginning to get information out. They're starting to get flyers out, so we've got a flyer about a new way to get Medicaid. These have not come to us yet, but they're on the website, so they'll be really pretty when the state has them printed. And I can tell you that, for example, I've been to talk with our PATS folks, which is our transportation system, and I'm having conversations with other folks to see if we can get these maybe inside posted in various places. I'm gonna talk to the city to see if I can do that with the city buses. Many places where we can get this out so folks can see it, because it tells you, you can't read much while you're sitting there, but at least it tells you something's happening and you need to go check on it. So the other thing that's going on with Medicaid transformation, many of you may have heard that the state has delayed going live. Due to the budget, the state budget,
I'm not surprised.
that was not, when the budget was not passed, the money to take it forward is not there. There was a budget attempt they're doing mini budgets for different pieces, and the mini budget for Medicaid transformation was vetoed. I'm understanding that there may not be enough votes to override that veto. So with all of that going on, the state has decided to delay the go-live for the first two regions that was supposed to go live in November. Everybody's gonna go live February 2020 as a result of this delay. So we'll see how that goes. Folks in Phase 1, and the closest Phase 1 counties for us are Wilson and Nash, I believe. The folks in Phase 1 can continue to enroll. They're not going to be auto-assigned. None of that's going to happen to them. They're going to get auto-assigned just like us, which will be after December 13th. So everybody will get auto-assigned after December 13th. So
Auto is
auto means,
automatic.
yes, it means the computer's gonna run an algorithm and say, you're gonna go to this PHP based on certain factors. One of which is, who your current doctor is and who he's enrolled with. Okay. It looks like we've pulled some numbers off the state. Like every so often they'll give us new numbers to say, okay, what's it looking like for you? And Pitt County right now is looking like about 59% of our folks will be in the standard plan, which is 16,401 people for your benefit. And we have about 5,900 who are going to be temporarily excluded, and they will go live in 2021 sometime mid-year, and that's your behavioral health folks. For the most part, that's who that is. And then there are going to be some folks who are permanently excluded, and for Pitt County, that looks to be about 6,000 plus or minus a few. That's folks who get family planning and, those kind of single service kinds of things. So that's what's going on number-wise, and they keep evaluating the numbers periodically to see what's changed. Right now, we are spending a lot of time validating addresses to make sure that everybody's, because the state mailed out to lots of folks this information, and all those that came back, they then sent to us to get a new address for those folks to get it corrected in the system. The call center is up and running. They have had a couple of glitches, but basically they're doing a real good job of getting the answers. Just to give you a sense of numbers, between August 1st and August 13th, they had 7,218 that had enrolled. They're getting a lot of traffic on the web and through the phone application. So not as many folks making the phone calls, but they're getting a lot of those. Providers are continuing to enroll. I do not have a current number of providers that enroll, but they are still continuing to enroll with the PHPs. Pitt County is doing their readiness assessment right now. We met today and reported to the state today on where we were with our readiness. We've got a lot going on. We've reached out to, we've sent copies of a lot of this stuff that you have sitting in front of you. And the website, we're going to see a video in just a minute. We've sent that out to a variety of partners in the community so that they can start pulling those kinds of things up, post things if they want to before the state is ready to actually send us hard copies. The video I'm going to try and get in a variety of locations also for folks to see. It is on our website. By our website, I mean the DHHS website. Mike and I have met it. We're going to try and get all this on the county's website and our Facebook page so folks can touch it and see it. On October the 4th, we are still working with the providers, as you see on our upcoming events, to have what I'm calling a Medicaid Transformation Fair. Our providers, the PHPs will be coming to town. They're going to set up shop for the day at the Cooperative Extension Building and be available for folks to come through, talk, whatever. The enrollment outreach specialist is also supposed to be there, again, to give, we've got to start advertising it, but again, to give folks the opportunity to come. As we hear about community events, and I think there's one Trillium's doing, and there's one Farmville that's happening in Farmville, we're letting the outreach folks in Raleigh know about it so that they can maybe set up shop at those so they can talk to folks. So those are mostly October events. So that's going on.
In the south.
Unless
Okay,
people
county.
tell me about it, I don't have a plan yet.
Okay.
Okay, most of these are fairs that other people have set up, and so I'm just, as I hear about them, I am letting Raleigh know about them so that they can send a specialist if they have one available. So if there's any activity going on anywhere in town, folks need to let me know where a large group are gonna be gathered together, and we'll get that done. So I have handed you a fair number of documents, a basic question and answer document. So these are some of the things that folks think they're gonna be asking a lot of. You have a copy of a basic flyer about what's coming with Medicaid. So in case you wanna, have that, mine's in color, yours is not.
Important.
Yeah, so you can share that if you want to. We have, this is gonna be a much smaller handout when the state does it, but it's the way it printed for me to tell you again, a real quick, what you need to know. There's I've also provided to you a health plan comparison chart. We talked a little bit about that before, but we didn't have a lot of, it wasn't very easy to follow. And so now on the back of this chart, you can actually see what the different providers or plans are offering. Because each plan is offering slightly different things. For example, WellCare is going to do a $120 GED voucher if you want to go work on your GED. United Healthcare is offering some life skills training. So you can see different things that they're going to be offering to support.
These are like bookmarks.
Yes, ma'am, they are kind of like bookmarks. You could cut that out if you wanted to and use that, but, and it would tell you what your different providers are offering. So, I'm not gonna go through all this, just wanted you to have copies if you've got any questions. Right now, I'm gonna ask Susan to bring up the video that, we can have, it's a YouTube video. So, we can get that addressed to you if you want to and send it
Since
out.
you mentioned that, are you running anything on GPAC?
No.
See, you know what GPAC is? GPAC is a government television station. And,
Mike could do that for us.
that's what
I'll get with Mike
I
Emery to
think
see
that's a
about
good
doing that.
way to check into that.
You may also be able to schedule an appointment to go on and actually talk about some of these events that where they're gonna be at. I can get you a good information for that.
Okay.
'Cause
Well, and we can start putting on the various websites that we have access to, the various fairs that are going on. For example, the one in Farmville, I can't remember exactly who's sponsoring it, but it's for that part of the county and Greene County to come in. It's a health fair. The one that Trillium's doing is a similar, it's for Trillium folks, and it's about Medicaid transformation. So it's a good opportunity because some of the folks Trillium serves will be in the standard plan and some will be in the tailored plan. So they're starting to do that kind of thing. So, okay, good idea. I'll put that down. Okay, let's try this video now.
is there any sound to
There's
this?
supposed to be sound.
Oh, okay. I'm listening, I didn't hear, just wanna.
Let me go. I was gonna check with him. I can do it. You going? Yeah, let's do that.
Do we know how many Medicaid people we have in Pitt County?
I do not.
I think that'll be something good for her to tell us. You think?
Okay, it's muted on the computer.
Care provider.
Do you have a way of knowing how many Medicaid people we have?
We have 27,753.
27,000.
753 as of June 17th. Again, it fluctuates.
If you live in North Carolina, there is a new way to get Medicaid. Medicaid healthcare. Most people will get the same Medicaid services in a new way, from health plans. Enrolling in a health plan will save you time and resources in getting your health care. You will have access to a network of providers, you can see your doctor as often as you need, and you will also have access to a 24-hour nurse line. You will choose a primary care provider and a health plan that are best for you. A primary care provider is your family doctor, clinic, or other healthcare provider. You will see them for all your medical needs. If you need care beyond what your doctor can provide, he or she will refer you to a specialist in your plan. You also have a choice of health plans to fit your healthcare needs. A health plan is a group of doctors, hospitals, and other providers. They work together to give you the healthcare you need. Health plans pay for healthcare services including doctor's appointments, inpatient and outpatient hospital services, nursing home services, prescription drugs, dental services, routine eye exams, and more. For a full list of what is covered, visit ncmedicaidplans.gov. In NC Medicaid Managed Care, there are 5 health plans to choose from. WellCare of North Carolina, United Healthcare of North Carolina, Healthy Blue, AmeriHealth Caritas North Carolina, and Carolina Complete Health. Most people receiving Medicaid must choose a health plan. A small number of people will not need to choose a health plan because of the type of health services they need. They will stay in NC Medicaid Direct. You will receive a notice telling you if you must enroll or can choose to enroll in NC Medicaid Managed Care. Here's what you need to do. Step 1. Choose a primary care provider. If you want to keep your current doctor, you can ask them which plans they work with. You can also visit ncmedicaidplans.gov, use the NC Medicaid Managed Care mobile app, or call 1-833-870-5500 for a list of doctors and other specialists. Step 2. Choose a health plan. You can learn more about the health plans available at ncmedicaidplans.gov/choose/compare plans. Step 3. Enroll. You can enroll by going to ncmedicaidplans.gov, where you can chat with an enrollment specialist. You can also use the NC Medicaid Managed Care mobile app. Call 1-833-870-5500 or fill out and mail or fax in the enrollment form you will receive in the mail. If you do not choose a health plan or primary care provider, one will be chosen for you. After you enroll, your chosen health plan will mail you a welcome packet and Medicaid card. You will use your new Medicaid card to get healthcare services. You will have 90 days after your health plan starts to change your plan or primary care provider. Depending on where you live, you fall into Phase 1 or Phase 2 for enrollment. If you live in one of these counties, you are part of Phase 1. You must enroll between July 15th and September 13th, 2019. Your health plan will start November 1st, 2019. If you live in one of these counties, you are part of Phase 2. You must enroll between October 14th and December 13th, 2019. Your health plan will start February 1st, 2020. If you have questions, there are several ways to get more information. For questions about your Medicaid eligibility, your local Department of Social Services, or DSS, can help. You can find contact information at ncdhhs.gov/localdss. To learn more about choosing or enrolling in a plan, you can go to ncmedicaidplans.gov for more information or to chat with a specialist. You can also call 1-833-870-5500 to speak with someone. The call is free. If you have questions about your health plan or specific benefits, call your health plan. Once you receive your Medicaid card, this information can be found on the back of the card. You can also find contact information at ncmedicaidplans.gov.
So clearly they have not updated this, and I don't know whether they will update the date for that Phase 1 piece. But it is a good, quick overview, I thought, and would like to get it out in more places. Wanted y'all to see that, and you know, we can, like I say, could get it in other places if we need to. So,
I was thinking, could there be a link on local hospitals' websites for this? I think that you know, people opening up websites when hospitals could see it, even school systems.
Right, and
Maybe.
I noticed that the provider section of Medicaid transformation, they've got their own section in the big Medicaid piece, has the exact same documents and the web page, the video that they can link to. It's already in the provider section. So, so the hospitals probably already have access if they know to go look.
Okay.
Okay?
And this will be on our website, DSS
That's,
website?
yes, we just got all this in the last few days, so we're gonna start, getting it out there. I've talked to Mike, and he's gonna try and get it on our website.
The advantage of having everything the same is it won't be confusing to the general public. That
Absolutely.
they all will be looking at the same
Right.
thing, and they all will be seeing the
Right.
thing. I think that was great.
Okay.
I do have a question. So this is gonna happen statewide, so how does it work with, how will this integrate or interact with the Healthy Opportunities pilot? Should we get that funding in our area for the 7 or 8 counties?
Well, it's the Healthy Opportunities pilot has its own money coming with it. And, you, I know that the providers are already starting to do screening, for the social determinants of health kinds of issues. I went to my doctor the other day and got screened. And so, that'll be a resource that providers will have. The PHPs will know about this and know how to make those connections. NC Care 360 is already out there and operating in Pitt County. We're on there as of this morning. So, I'm thinking it's gonna connect nicely. It's a piece of the whole pie, so to speak.
So isn't that a subset, is that focus gonna be a subset of Medicaid beneficiaries, or is it the same?
It's the same beneficiaries.
It is, okay.
So everybody who comes in with Medicaid will get those questions asked, and those who don't get Medicaid will get those questions asked. And if in fact you're a Medicaid recipient and have a housing issue, then that referral will go out for assistance with that.
Okay, thank you.
All of these changes just must be a bit for the staff. That I guess that's been my, I won't call it a pet peeve, but my whatever, and
Concern.
yes, there you go. Concern, thank you. And to have all of that coming at you and so many changes with the structure that, it just bothers me that we may be in error of something without our own fault.
Right, well, yeah, for this particular piece, the biggest issue I think we're gonna have, because we're not doing enrollment, we're not trying to help you figure out which plan is best for you. The biggest issue is if you have a question about your Medicaid, you're not gonna say, oh, I don't need to call the DSS to find out about my Medicaid and my provider. They're gonna call the DSS, and then we've got to make the right connection for them to get them to the right spot. They're asking us to connect folks, not to say, hang up and call 1-800. They're saying, let's transfer them while they're there. Let's set them up in a room or at a phone where they can have that conversation while they're in your office. Don't send them away. So we're thinking that the biggest impacts we're gonna have is folks asking questions and coming to us, so a lot more traffic. We're obviously gonna have to deal with all of the address issues, because people move around a lot and don't always tell us. And once you get your Medicaid card, you won't get another communication from us for a while, so it's up to you to tell us you've moved. So
That's a problem.
so that's gonna be an issue for staff to have to deal with. Another concern has been the way the system, NCFAS, the way the system is set up. Everybody is their own person, so to speak, in the system. And they're not necessarily, mom has to be the representative for all of her children. And I don't know that we all thought how important that was. So what the counties in the first part of the state that was going with this found was that mom was not listed. And so mom was taking care, got the notice for herself if she was included in Medicaid, but the oldest child got the notice for the rest of the family, and mom can't do anything with that group because she's not listed as their representative. So folks are now having to go through and make sure that those connections are made. Because 3 or 4 years ago, when this system was programmed, nobody really said that was important. We had mom, we had the address, we had the children, we had the address. It looked connected to us. That's not the way we've ever operated before it was a case. And it's not that way in
And
the
they
system.
didn't put an interface in there?
Well, they're working right now to try to figure out, get us a report so we can know who it is. We don't even know which cases are like that right this second until they can generate some type of report for us to show a minor child with no connected adult. The issue we're going to have to deal with Cynthia and her folks, for whom we're guardian, is to make sure that same kind of connection is made so that the ward is not getting the information, that the information's coming to us so that we can help the ward get what they need. So little things like that are going to be
Well, see-
extra activity and extra work and a little bit of confusion.
That's what I was talking about staff and the connection. And those were some of the questions that we were asking as county commission in one of those sessions over in Greensboro. And they said, well, we don't know yet. And every time we asked them, well, who's gonna pay for it? We don't know yet. There was so much into it, not knowing, that it made me nervous for the welfare of the family.
Well, we're working through a lot of things. There have been a lot of, considering the magnitude, and we're still early into it, I'm sure, but considering the magnitude, we could have had a whole lot more glitches than we've had thus far. But folks are working through it. They haven't had a huge number. Now, again, you were looking with 27 counties. When 100 counties roll in, it could look a little different. But they're identifying it with this small group, which is why it was good to have the small group.
Yes.
And I'm happy that we were not a pilot county for this. But so there've been little things that are requiring some extra work of counties to get things resolved.
That would've been nice if we'd been the pilot.
Yeah, so anyway, so that's where that is. Other questions about Medicaid transformation? Just wanted to have you kind of up to date. We've had a lot of movement back, I guess, would be the right statement, in the last few weeks. So I felt like that needed to be part of the conversation today. Okay.
Thank you.
Okay. Medicaid application processing report. As you can see, we are where we need to be. We have, you have the chart in front of you. Again, you see some areas in months prior that it looks like we have not met standards, but again, those were situations where we got the waiver, so those are not issues for us. You can see that our timeliness rate is 96% and 95%, and you can see that our average processing time is 45 and 31. So we're doing really well.
I have a question. When I see these, like the red line falling below, do you have someone on staff who can try to determine what caused that?
Yes, ma'am. We know exactly what caused this. It was a specific problem, and we were able to get a waiver. So that is not counting against us.
But we have to know
We
it
have
to
to
them.
know it. We have to document the why. We have to write the request, and then they will determine at the state level whether they will grant that waiver or not. And in both situations, this one, we went about, a couple points below, and in this one, we went probably less than a point below. And it was something that was waivable, and we were able to get it waived.
Because that's the kind of thing that they start finding on, am I right?
Yeah, this is the one that if you do 3 back-to-back or 5 in a 12-month period of time, there could be the potential of takeover and all those kinds of things.
And how long does it take for the waiver to be approved?
It took about 3 months for the one back in March. The one in the next year took a little less than time, but about 3 months.
Isn't that a long time?
Well, it takes they've got to go do their research and validate that the information that we provided is the accurate information.
It's good to have a good staff.
It
And
is good to have a
a
wonderful
great
staff.
staff. I have
right.
no complaints about the
That's
staff
right, our
we
staff
have.
do wonderful things. The other thing we have on our standard report is our agency personnel report. We right now have 20 vacant positions. You can see that John and Tamika and Shanice, you met today, so. We have one other person that was supposed to be here today, but he's in training, so we'll introduce him at another time. So, so we are recruiting, interviewing, moving along. Some of these, remember, are related, as we said last month, to some of the new positions coming online and recruiting for. Some of this is related to internal movement, because we've been doing a fair amount of promoting internally, which creates vacancies at the entry level, which is where these positions were.
I think this new thing that you instituted today with us actually meeting the staff, I think that's very positive, and kudos to you for that. That's the positive one, isn't it?
Your leadership made that suggestion, and I
Thank
think
you.
it was an excellent suggestion.
I think it was excellent. I'm glad you accepted it.
We're also gonna start bringing folks with 5, 10, 15 years, sort of like you do with the commissioners, so that
Good
y'all can meet
longevity.
those folks and congratulate them on
Thank
their
you.
longevity.
I think that's nice.
Okay. So that is what I brought. I sent y'all at the last minute the director report online the other night. Didn't know if you had any questions about that, the August report. It was supposed to be out to you earlier, but a thing called Dorian kinda got me behind a little bit. I didn't know if anybody had a chance to read it or had any questions.
Questions?
And you can
about the
certainly
written
reach
report?
out.
No,
Okay.
I'm pleased. If I'm not
Thank
happy, I'll
you.
let you know.
At this time, we'll have board member comments, and we'll start with Catherine.
I don't have any at this time.
Okay.
I have a board member comment. I've been educated on things, and since my area is, which is north of the river, is an area that normally flood, and gratefully to God that we did not flood this time. I want to say that mold, watching mold as it occurs on the exterior and the interior of your house. So I had a quick lesson in mold. If it's green, wash it, get it clean immediately. If it's gray, it's growing into something else, clean it. And when it gets black, you have to have a specialist to come in and see to it. That's when it starts to cost money. So I'm recommending that everybody use some good old cleansing stuff that you can get from Agri Supply and clean your house prior to before it develops into something, because mold can be a serious issue.
Yes, it can. Anything else?
That's it.
Well, thank you for that public service announcement.
Thank you
I'm
all
sure
for
there
your
are other
patience.
places besides Agri Supply that you can go
Yes.
with.
I would like to say that ECVC will host their 54th annual banquet on Thursday, October the 3rd. If you would like more information about it, you can contact ECVC at 252-758-4188.
All
I
right.
think we've already
Thank
got
you.
an application.
I'd just like to commend the staff for all they do, and last week you went into emergency mode with the shelters, and people had to think about taking care of other people while they had things to take care of themselves. So kudos to Ms. Elliott and all of the DSS staff that had to I don't want to say man the shelters, but to work in the shelters.
They're
All
good.
right.
They're good.
Is there anything else we need to consider today?
Madam Chair, if I'm in order,
You are.
I move that we adjourn.
Is there a second?
Second.
All in favor?
All in favor?
Let's get up and go.
Motion carries. We'll see you next month.